No, these are bidirectional. Bidirectional. We also get the question of how much Amnion is in this particular one. It comes in 2 sizes. This is, can I have a flyer, please? This is a 10 millimeter, right? And the Amnion's equivalent to an 8 millimeter regular Eclipse that we have, the Amnion tissue. And then we have a 12 millimeter Aurora. You can see it right there. Okay? And so the Amnion is equivalent to a 10 millimeter Eclipse, which would be the full disc. But they're all bidirectional, 5-year shelf life. But this is one I go to, especially with my patients that are coming back from a post-PRK from like a LASIK touch-up or a SMILE touch-up. But the one that had that shunt repair, that way we could kind of push it down, cut it in half so that I could get it on that limbal region for that shunt coverage, and then put the other one up at 11 o'clock. Okay, so when I'm in practice clinical setting, I'm going to get over there because I'm left-handed, if it's okay with you. And I've already cleaned my... Do what?
Left-handed also.
Nice. So if I'm in clinic by myself, somebody always asks me, how would you do this application? So I've already numbed her, by the way. She's already got tetracaine in. And I actually...
It was when we started.
Do what?
It was when we started.
Oh, she's awesome. She should be there.
I probably get about 10 of these per show. Well, no, per day per show.
Yeah.
So, yeah, I'm like, it's fine.
So this is the technique I use, where I put it right there. So that way I can still keep her lid everted. So I'm going to just tilt her back, and I'm going to be right here. So I can do that. I'm going to lay my forceps over that way. Sometimes I just put my forceps right here as well. But this is the Aurora, so it's got the open port. So he asked the question about which direction it would be. I think you did. So it can be bi-directional. This one, obviously, with the open port. Here we go. When we go in, you'll get heat from the body, so you might see a little bit of a curvature, right? Or what I call the stingray effect. So if that's the case, I just roll it over. But in this case, with this one, you're wanting to try and avoid any kind of folds at 9 and 3 o'clock, so you want to tamp it down. So I'm going to go from top to bottom when I apply it. Questions so far? All right, lean back. Here we go. And just look right there. That's perfect.
Five years.
So I got that in place. Here we go.